Hello there. It is my pleasure to provide you with some practical information to help you through your surgical journey. It is completely normal to feel nervous about the unknown. Together, we will explore how to best prepare, what to expect, as well as the best way to become involved in your recovery of your upcoming surgery. All information presented is recommended and supported by a critical review of the medical literature, including the recent recovery pathway called ERAS, standing for Enhanced Recovery After Surgery. When compared with traditional operative care, using aspects of ERAS has been associated with decreased pain and length of stay, while simultaneously improving patient satisfaction and quality of life. This will help you recover more quickly and resume routine activities in a timely fashion when compared to standard surgical care. Planning ahead of your procedure and going in as healthy as you can will have a positive influence on your procedure and recovery. Pre-operation information and preparation can reduce fear, fatigue, and pain while speeding up the recovery process. Plan to stay in the hospital for 2 days after your surgery. You'll be ready to go home after the second day. Just like a marathon, a surgery is something that is best approached when one is prepared, has as much energy for the duration of it, and takes the appropriate measures to recover from such a physically and mentally draining day. You should spend the time before the procedure being as active as you can, whether that involves going for short walks or exercising, eating right, and getting a good night's sleep. If you smoke or drink alcohol, you'd benefit to stop as soon as possible, because smoking can cause problems with breathing and recovery from surgery, and stopping alcohol consumption reduces post-operative complication rates. Prior to your surgery, you'll need to do some preparation at home. Doing the following in advance will help your recovery process go smoothly. Make sure that you get a walker ahead of time. Check with your surgeon to see if you need a raised toilet seat. You will need a coach. The coach will help motivate and support you. Your coach can be a friend or a family member who can help you throughout your surgical process. Make meals ahead of time and freeze them. Set up a living space on one floor and minimize clutter in your home to lower your risk of falling. Install shower equipment such as grab bars, rubber mats as needed. And arrange for someone to take you home from the hospital and someone to help you for 2 weeks after your return home. Physiotherapy. It is important to do your physiotherapy before surgery. Exercises will help get your body in shape and your legs as strong as possible before surgery. Most people are able to perform the following movements. If the exercises make your symptoms worse, you should stop. Increase movement and circulation by first pointing your toes downward, then upward in a smooth, steady motion. Repeat 10 times hourly with both ankles. Tighten the muscles on the front of your thighs by pressing the back of your knees flat against the bed. Look for a visible contraction. Hold for 5 seconds and release. Repeat 10 times, 3 times per day. Lie on your back with a rolled towel under your knee. Straighten your knee in a kicking motion, still supported by the roll, and hold for 5 seconds. Slowly return to the starting position. Repeat 10 times, 3 times per day. While lying on your back, tighten your buttock muscles. Hold tightly for 5 seconds. Repeat 10 times, 3 times per day. Slowly bend your hip and knee as high as you can, sliding the heel along the bed. Hold for 5 seconds. Slowly lower your leg back to the starting position. Repeat 10 times, 3 times per day. Lie on your back with your knees straight and your toes pointing upward. Slowly move your leg out to the side as far as possible and then return to the starting position. Repeat 10 times, 3 times per day. One by one, bend your hips and knees, sliding the heels along the bed. In that position, raise your buttocks off the bed. Hold for 5 seconds. Slowly lower back to the starting position. Repeat 10 times, 3 times per day. The exercises you will do after the surgery will differ depending on the exact surgical procedure. After your surgery, the physiotherapist will show you exercises that are correct and right for you. Based on ERAS, and to be confirmed by your healthcare team, the recommended pathway typically allows consumption of solid foods up to 6 hours prior to surgery, clear liquids up to 2 hours prior, and encourages preoperative carbohydrate loading, a strategy utilized by marathon runners to maximize the storage of energy in their muscles and liver. You can drink clear liquids such as water, black tea, black coffee, or apple juice up to 2 hours leading to surgery, but no liquids such as milk or orange juice are allowed. To improve recovery as your last drink, some physicians will recommend to have an apple juice 2 hours before your surgery, as this has been shown to improve recovery. Before surgery, patients should shower full body with 4% chlorhexidine gluconate soap the night before and also the morning of their surgery, as it has been associated with a lower risk of surgical site infections for patients undergoing orthopedic procedures. Any body hair in the area of the surgery will be clipped at the hospital. Do not shave the area yourself. The day of surgery. Bring your coach to assist you. That person will help you throughout your recovery period. Wear comfortable clothing and good walking shoes. Wear or bring loose-fitting clothing and shoes with Velcro or elastic laces. Your leg or foot might be sore or swollen from surgery, or you may have bulky bandages over your incisions. Bring toothpaste, toothbrush, pajamas, a denture cup if needed, and any medication that you take regularly in a labeled pharmacy container approved by your healthcare provider. Leave jewelry and valuables at home. You may also bring a music listening device for your entertainment. On the day of the surgery, the healthcare provider who will admit you will check your temperature, blood pressure, pulse, and breathing, review your medications, and help you get ready. You'll receive some medications before and after surgery to improve pain control. An intravenous tube, called an IV, will be placed into a vein in your arm to give you fluids and medications. When you're ready, someone will help you onto a stretcher and take you to the holding area and then to the operating room. It is important to note that you will not be put to sleep for the surgery, but will receive a spinal anesthesia. This is done through a needle in the lower back, which will freeze the sensation in your legs so that you do not feel any pain throughout the surgery. Spinal anesthesia is associated with reduced anesthetic complications when compared to general anesthesia. You'll be awake during the procedure and are welcome to listen to music through headphones if you so prefer. Immediately after your operation. Post-operative ERAS elements typically focus on pain management, bowel function, diet, and early mobilization. After surgery, you may feel cold and have pain in your leg. The sensitivity to pain is different for each person. If you're having pain or nausea, tell your nurse, who can help you get more comfortable and give you medication. If your mouth is dry, you may start drinking water. Feeling stiff or achy is also normal at this time. These feelings will go away when you can move around more. You'll get out of bed in the few hours following your surgery. We will help you take a few steps, and we will help you sit in a chair. If you feel faint or dizzy, call the nurse to help you back to bed. You'll be encouraged to urinate in the bathroom. If you have difficulty urinating, a one-time catheter may be inserted to drain your urine and then it will be removed. It is important that you perform deep breathing exercises. You'll receive an incentive spirometer, which is a device used to help you open up your airways after surgery. Breathe in deeply through your mouth, around the mouthpiece, and relax the air out through your mouth. Use the incentive spirometer at least 10 times an hour while awake. If you feel like coughing, don't hold back. A proper diet will allow you to maintain normal blood sugar levels, which will help you recover faster and decrease the risk of post-operative infections. A recommended diet is one which is diet as tolerated or a standard diet and is started soon after surgery. You may need a stool softener, a laxative, or an enema to enhance the bowel movement. Passing gas or having a bowel movement will often take away gas pains. Walking around, gum chewing, and drinking caffeinated beverages can also help make bowel movements come more quickly. The following days. Mobilization. On each day after your surgery, it is advised that, provided you feel well enough, you sit in the chair at least 3 times with intermittent rests on the bed as needed. You should aim to walk along the ward corridor. Being in an upright position, getting out of bed, and walking will help improve breathing, increase muscle strength, and decrease the chance of clots in your chest and legs. It will also help return your bowel function to normal more quickly. Diet. You should try to drink about 6 to 8 drinks, about 1,500 ml per day unless you feel sick or are told otherwise by your healthcare team. Each cup is usually about 150 to 200 ml. You can drink a variety of non-fizzy drinks while you're in hospital. Choose foods that are high in protein and fiber to help you heal and promote bowel function. Criteria for discharge home for any patient undergoing orthopedic surgery includes tolerance of a regular diet, ambulation or ability to move, ability to go to the bathroom, and appropriate pain control. To get into a car, always sit in the front passenger seat so you have space for your legs. Back into the car and sit down. Turn your body to face forward as you or your coach helps to lift your operated leg into the car. To get out of the car should be parked far enough from the curb to allow you to stand up with the help of a walker. Turn your body to face the door as you or a family member or coach helps to lift your operated leg out of the car. Step down to the street and up to the sidewalk. Don't try to straddle. To make the turning easier, you can put a plastic bag on the seat or a cushion. Avoid small, low cars and high SUVs. It may be easier to get into and out of a regular car and use a cushion if you need to make the seat higher. Post-hospital recovery. Your wound. Once you are home, a nurse will call you to arrange a time to change your wound dressing, if it is needed. The clips will be removed around the 10th day after your surgery by the nurse. You will also be contacted by your healthcare team to arrange physiotherapy. Showers. It is not recommended to take a bath. If the wound is no longer leaking, you may take a shower beginning 5 days after your surgery. If you're not sure about this, you should contact the nurse taking care of your wound. You can take your shower either while standing or by using a shower seat to assist you. Diet. A balanced, varied diet is recommended. Try eating 3 or more times a day. To avoid constipation, choose foods that are high in fiber and drink plenty of fluids. It is still important to obtain an adequate amount of protein and calories to help your body heal. Medication. You'll be given a prescription when you leave the hospital, which will likely include an anticoagulant, which helps decrease the risk of blood clots, and pain medication. The anticoagulant pill will be taken daily in order to reduce the risk of blood clots. You will also be prescribed pain medication, including Tylenol, and a painkiller if the Tylenol is not enough. It is advised to take the Tylenol first and only fill the prescription for the painkiller if your pain is still not adequately controlled. If you choose to fill your prescription but do not finish the medication, you need to return any unused pills back to your pharmacist for proper disposal. Getting dressed. For your safety, you should dress and undress your lower body from a sitting position. To put on pants or underwear, start with the leg that was operated on. To take off pants or underwear, start with the non-operated leg. Exercise. Do the exercises and follow the restrictions that were taught to you by your physiotherapist. Speak with your orthopedic surgeon about specific activities you wish to start and ask about when you can resume the restricted movements and positions. After you have fully recovered, in about 6 to 12 weeks, choose activities in which there is a low risk of falling or injury. Low-impact activities such as walking and swimming are recommended. Avoid high-impact activities such as running and contact sports such as hockey. Driving. You should not drive until you're confident that you can drive safely. You can start driving 2 weeks after your surgery. If you have any concerns, check with your orthopedic surgeon. A good yardstick for this is when you've resumed most of your normal activities and are not on any strong painkillers. It is important that any pain has resolved sufficiently and that you are not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. This enables you to maintain your activity and will benefit your recovery. You should not need to restrict these unless they cause significant pain or involve movements that you were instructed to avoid. Sexual activity. You may resume sexual activity when you feel comfortable. You must still follow your movement restrictions to prevent a dislocation if you had a hip replacement surgery. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed and to get out of bed each day and get dressed if possible. Sleep. If you had a hip replacement surgery, you can sleep on your back. If you put a pillow in between your legs, you can sleep on either side. Lastly, you must tell your dentist or other doctors that you had a surgery. Your dentist or doctor may treat you with antibiotics to prevent an infection. In summary, to enhance your recovery, you will greatly benefit from returning to normal gradually and as quickly as possible. This means that you need to actively participate in your recovery by moving, eating, and drinking. Each day you should feel some improvement, but do ask your healthcare provider if you're worried about something. On behalf of the pre-care team, we wish you the absolute best on your journey. After your surgery, daily activities might initially be more challenging. You can purchase equipment that can help with these tasks during your recovery. For example, a reacher to help you put on your pants, a long-handled shoehorn to put on shoes, and a sock aid. These can be found at your local pharmacies or orthopedic equipment stores. Please take the liberty of pausing the video as necessary in order to get all of the information on the next frame. Please contact your family doctor or surgeon if you experience any of the following: a fever higher than 38 degrees Celsius or 100 Fahrenheit, or your incision is getting more red, painful, or draining fluid. You should go to the emergency department if you feel any of the following: if you experience any chest pain, difficulty breathing, dizziness or fainting, or if you experience an increase in pain, swelling, or tenderness in your leg that does not get better with pain medication.